This is very important. Why we should be focusing on cardiac disorders? And I say, always say that this is less explored area in the Ayurveda field, but it is possible that we can contribute a lot in this region. Whether it may be prevention, if we can prevent such type of condition, that may also cause a kind of help to the human being. And you will see that in this slide you share that like young people like Siddharth and Raju Srivastav and this singer KK, these are all in their early 50s and 40s, and they suffered from sudden cardiac arrest. And whatever may be the cause, maybe like ati vyayam or overexertion or not taking rest properly, or so there are many such conditions which can take place, and so we should be really very cautious about all these type of happenings which are in the society. What would have been the clinical reasons behind such a surge? Yes, just you will say that there are certain like possibility of development of thrombosis among the COVID-19 recovered patients. This is a quote by Dr. Avinash Supe in charge of COVID-19 death committee. Again, beside the rise in these risk factors, Indians have a genetic predisposition, smaller coronary arteries, a diet pattern which is excessive consumption of trans fats, and sedentary lifestyle that puts them in high risk category of heart attacks. So these are all the explanations that can be given to the situation which is arising nowadays. Again, this is the probable mechanism. Everybody is talking now about the COVID-19, post-COVID-19 infection. There is lot and lot of, you can say, such type of cases have increased. Though there we cannot say something directly because there are lack of studies are there. There are not much studied which can correlate all these conditions with COVID-19. Still, this incidence has really increased from this post COVID-19 era. So we can presume, but definite, we cannot go to the definite results as it is really immature to say at this time. But there is a study in the Lancet that reveals that damages of the heart and blood vessels in infected patients, which leads to the development of clots, heart inflammation, arrhythmias, and heart failure. This is not our study. This is by Lancet. So we should take care of such type of studies, and we should sincerely watch such type of studies, and for our the benefit of our public, we can take help of such. If you are affected by COVID-19, the risk of first heart attack increased by 3 to 8 times. This is not a quotation by Ayurveda. This is by Lancet Medical Journal published in 2021. So you will find that there is a kind of relation with the post-COVID, you can say, infection, whatever may be the cause, whether it may be the COVID infection, which is the main cause, or which may be the prophylaxis we took against, like anything like vaccination or something else we are taking that may be resulting in such type of condition. So really this we have to think about. And now this is a really this is not my quote. This is 2 3 days or yesterday we have seen in the Indian Express that COVID shield could cause blood clots in very rare cases. Manufacturer AstraZeneca has said. What does this mean? So definitely there are very rare cases, but still, if it is going to happen one in a lakh, but still there is a possibility that anybody can suffer from such type of condition. So this is also a kind of concern, and we should take care of, and we should come out with some kind of Ayurved remedies which will be helpful for preventing such type of condition. Or we can take up a study which can you can say uh, we can take cases from which are having after vaccination, and we can study and we can intervention we can give from Ayurveda side. So how much reduction is there in any type of complication that we can presume.